Assalamu alaikum warahmatullahi wabarakatuh. I'm Dr. Akram Alshirah, a PhD graduated from the UK 2025, master from this progression as well from Germany. So I'm periodontist. I just want to share with you this case about the soft tissue dehiscence and the implant in the aesthetic zone and the tooth number 21. This 24 female patient came to my clinic. I'll ask about the bad aesthetic zone in the this combined with this implant. You can see the crown is parallel to the imaginary line between the lateral and the tooth number 2 and the tooth number 1. Furthermore, the apartment as well as parallel. So the plan was to remove the crown, the apartment, connect tissue graft, and use the platelet concentrate with some stem cells and platelet concentrates to promote the healing. This was after removing the crown. You can see still some of the apartment is clear partially to the soft tissue as well. So the plan was to make a submerged technique to augment this area. So after removing the crown, the apartment, you can see the connective tissue graft, coronal depositing flap. But there is a very critical information clue I want to convey that when you augment this and making a releasing incision, please try to not exceeding the macrogingival junction border. So try to stop in the macrogingival border. Why? Because there is elastin in the mucosa, there is no elastin in the attached gingiva, or at least it's minimized. So when you make the incision here, look at that. There's the like junction between the two edges of the incision after 2 days. So you will not leave any scar in the aesthetic zone when you make a releasing incision in the attached gingiva. While if you made that in the mucosa, you will find the scar very clear, and during smiling, laughing, it's very embarrassing to the patient. Please don't leave releasing incisions in the mucosa. This is the first thing. The another thing, I provided the patient with the Essex, the vacuum for healing, to provide the patient with a tooth. After finishing the surgery, the patient exits from the clinic with a tooth. Furthermore, that vacuum it's cover the palate in the area of the donor side, so it's protected from the tongue, from the food, from the temperature, from anything. So the patient is with a very, very positive feedback. And furthermore, I used the albumin CGF. I put the connective tissue graft. I put the albumin CGF covering that to optimize the healing. Look at the releasing incision, so you can't recognize it. It's after 2 days, 48 hours. So this is after removing the crown, just removing the apartment, connective tissue graft, and the albumin CGF suture to releasing incision. I reached in my flap elevation, the macrogingival junction, then I released the peristem so that I released superficial and deep because to remove the muscle attachment, this area, to remove as well the frenum from the attachment, and I've released the coronal bus flap a little bit, so I moved it coronally. You can see the healing, and look at the donor site in the palate. It's immediately after the surgery. It's bleeding, and you can see the adipose tissues as well here. So I removed free gingival graft according to the Zucchelli technique. Then I de-epithelialize it. I remove the excess of the adipose tissues. I put immediately the albumin, the not albumin, sorry, it's CGF membrane to cover the area, to optimize the healing, to accelerate the healing. So the result is immediately after. It's immediately after placing the CGF membrane using as well Oceanibin suture. You can see that there is no any surface, bleeding surface exposed to the oral cavity. Furthermore, I protected it with the vacuum. Yeah, you can see here. So look at the healing after 48 hours, 2 days. 2 days, the healing is amazing. But look at the border, the healing in the border, and the border of the CGF membrane as well. So the granulation, the epithelialization, and the border area demarcation. So it's amazing. The patient said, I have zero pain. Zero pain. So it's amazing to use the concentrated growth factor or plated concentrate during your surgery. Look at the final. So it's with the crown, without a crown. And I asked the patient as well, please remove this 3 times, triple a day, to reach the wound with oral hygiene liquids, mouthwash. So 3 times, remove it, mouthwash, and replace it again to continue to resume your day smoothly and eventfully with no any complication. And the patient literally said it's zero pain, and the healing process is supercalifragilisticexpialidocious. Can say that, and don't hesitate to reach out if you have any question. If you need any elaboration furthermore about this case, please don't hesitate to reach out via any way, via email, via social media. More than welcome. Assalamu alaikum wa rahmatullahi wa barakatuh.